Hello friends, welcome to my presentation. Myself Ajin Shah. Today I am here to present a video on the topic knee complex. First we can see the introduction for knee complex. Knee joint is the largest joint in our body. It acts as a connection between the hip and the ankle. It serves weight bearing and mobility. There is a greater chance for injury because lot of ligaments and muscles are passing through this joint. Knee joint is made up of two joints, tibiofemoral joint and patellofemoral joint. These two joints have different functions. First we can see about tibiofemoral joint. Type. It is a type of double condylar joint. It has 3 degrees of freedom: flexion and extension, medial and lateral rotation, and adduction and abduction. Structure. Structure is formed by distal end of the femur and the proximal end of tibia. Then we can see detailed about distal end of the femur. In femur, it has two condyles, medial condyle and lateral condyle. Peculiarities. Medial condyle is greater than the lateral condyle. In lateral view, femoral condyles are convex. In anterior, the radius of curvature is more when compared to posterior. In anterior view, the femoral condyles are less convexity than the lateral view. The lateral femoral condyle having slight anterior projection advantage to prevent patellar translations. In posterior view, both condyles are clearly visible. Both condyles are separated by intercondylar notch. Posteriorly, both annulus are joined together by intercondyles groove or patella sulcus. In inferior view, medial condyle is projecting downwards. Then we can see detailed about proximal end of tibia. Tibia also has two condyles, medial tibial condyle and lateral tibial condyle. Medial tibial condyle is larger. It is relatively flattened, but there is a slight cave in its center. Lateral tibial condyle is projecting slight anteriorly. Both condyles are separated by intercondylar tubercle. In posterior direction, tibial condyles are not straight. They are slightly inclined inferiorly. Then we can see about genu valgum and genu varum. Before entering into the topic, first we can see the axis for it. First, longitudinal axis. It is also known as an anatomical axis. It is an axis which passes through the center of the long bone. Due to the oblique nature of the femur, this axis slightly shifted, whereas in tibia it passes through the straight line to the center of the tibia itself. Mechanical axis. It is also known as weight bearing line or weight bearing axis. It is the axis through which weight is transmitted. That is, the line connecting through head of the femur to the center of knee joint to the calcaneum. Next we can see about genu valgum. In normal, medial tibial femoral angle is formed, that is, the angle between the longitudinal axis of tibia and the longitudinal axis of femur. It is an angle formed in the medial aspect. Here, the femur is tilted 5 degrees from vertical or medial tibial femoral angle. It is approximately equal to 185 degree. Femur is not in straight vertical line. It is tilted. So, normally we have physiological valgus. When the medial tibial femoral angle is increased greater than 185 degree, then the condition is called as genu valgum. In genu valgum, the entire femur is shifted to lateral side. In the condition genu valgum, simultaneously present in both the knees. So, it is called as knock knee. Here, both the knees will be together. Then we can see about genu varum. When the medial tibial femoral angle is decreases less than 175 degree, then that condition is called as genu varum. It leads to medial compartment joint arthritis, medial compartment articular cartilage damage, and laxity of ligaments in lateral compartment. In this condition, genu varum simultaneously present in both knees. It is also known as bow knee because here the knees will be separated. Thank you all for listening to my presentation.